All right. Good afternoon, everyone, and welcome to the second mini webinar in Colorado Center on Law and Policy's Communities Against Poverty event. This is Bob Mook speaking to you from my home office today. I'm the communications director for CCLP, and I will be hosting this webinar. So before we begin, I'd like to acknowledge and thank our presenting sponsor, Colorado Coalition for the Homeless. And I'd also like to acknowledge and thank our supporting sponsor for this webinar, Colorado Children's Campaign, and our executive director, Tiffany Lennon. This session is titled Food Security in Insecure Times. Over the next 20 minutes, we'll learn about pre-COVID-19 food security issues, food insecurity issues during COVID-19, responses to food security during the COVID-19 pandemic, and what we've learned during this period. Then our host, Sara Lipowitz, will share some closing thoughts and take questions, which can be submitted through the chat or Q&A features throughout the presentation. I will read the questions at the end. We'll leave a good 10 minutes for a Q&A with Sara. With that said, I'll introduce Sara. She's our public benefits attorney, and she develops and advocates for policies that will increase access to SNAP and other human service programs that improve Coloradans' health and well-being. Sara has been with CCLP for nearly 2 years now, and you can read up on her impressive bio and background on our website at cclponline.org. With that said, I will pass the virtual mantle to Sara. Good afternoon.
All right, thanks, Bob, and thanks to you all out there who want to tune in the evening to hear about food security. We define food insecurity as the state of being without reliable access to a sufficient quantity of affordable, nutritious food. Mostly when we're talking about solutions to food insecurity, we're talking about federal programs. The Supplemental Nutrition Assistance Program, also called SNAP or food stamps, is the country's largest nutrition program. It's also the state's largest. It's a federal program that provides food purchasing assistance to eligible households experiencing poverty. And prior to the COVID period, that was about 450,000 to 460,000 individuals per month. We also are talking about the Women, Infants, and Children program, which is a federal program that provides supplemental nutrition to pregnant women and their children up to the age of 5. Prior to COVID, we had about 13,500 Coloradans enrolled in that program. There are some other important programs that I'm going to mention as we go along as well, but these are some of the largest ones, the biggest players in the food system. Just to give you an idea of who gets SNAP benefits, 70% of participating SNAP households include children. 30% have a disabled family member. 46% have a working family member. So this program is a work support for working families. It's also a financial economic support for folks who are out of the workforce, either because they are experiencing disability, or they're not old enough to work, they are retired folks. That is most of who is on this program. Next slide. So the most recent data we have about food security during COVID is a survey commissioned by Hunger Free Colorado and they've done several of these since March, but the most recent one that they did covered the period September 15th, October 1st of 2020, and they surveyed more than 500 people, found that 11% responded often true to the question, I or we could not afford to buy all the food that was needed. The food just didn't last, and or there was not enough money to get more. Another 18% said that this was sometimes true. And what we've seen, sometimes there are different public benefits programs, and the interplay between them can render people eligible or ineligible. The extra bump that people got in their unemployment benefit kept a lot of people out of poverty. It also raised their income to where they were not qualifying for SNAP, but they have now, as most of you probably know, have lost that additional unemployment benefit, and therefore more of those folks are qualifying for SNAP, but the amount that they get from SNAP is not a dollar for dollar replacement for the money that they have lost. I think we're also looking at another drop off in the end of the year for people from unemployment, which is really distressing. There's people who are on their last extension, a 13-week extension, unless Congress acts, and I'm not sure how likely that is. These are folks who are going to lose perhaps what is the remainder of their income. So we're going to see those poverty rates rise. And what we've seen during this period is that application assisters and food pantries and food banks saw increases in calls and visits after the additional unemployment benefit expired without being renewed by Congress. The food pantries and food banks had to meet new challenges, and we'll go into those a little more deeply, but just in general, increased demand, inadequate storage facilities for fresh food, and getting food to clients while maintaining social distancing. And similarly, our partners at the state human services offices had to serve more clients while remaining physically closed. Next slide. Oh, thank you. Some of the COVID relief packages like Families First and the CARES Act provided some financial assistance that we have been able to apply to food insecurity. They did not provide as much as we would have hoped. And of course, there are other packages that we had been hoping to receive that are still on the table in Congress and not been passed. Also, what's been helpful are waivers of program requirements for SNAP, WIC, and the student lunch program. Some of these include a waiver of interview requirements, an expansion of the benefit amount, a temporary halt on claims collection, waiver of work requirements, longer recertification periods, or no location requirements for the serving of student lunches. There were also some responses by FEMA, Public Assistance Program authorized during federal emergencies to sell food to nonprofits and public organizations that can then push food out to their clientele. Application assisters saw calls for program assistance rise by 4 times their usual volume. And also Human Services and our friends at Hunger Free Colorado teamed up to roll out the Pandemic EBT program. Pandemic EBT was a way of providing families who were getting the school lunch benefit while schools were open, the cash value of the meals that they were not able to receive when the schools were closed. And that's a program also that we're hoping perhaps can be extended if and when a new Congress takes up this issue again. Next slide. Oh, and so I should mention before we went to the next slide, but that's okay. Food pantries saw visits increase by 40%. CDHS, besides getting waivers of some of these program requirements, they also oversaw the increased use of food programs like the Emergency Food Assistance Program called TFAP, the Commodity Supplemental Food Program, and Emergency Supplemental Food Program. These are programs that involve actual commodities being brought into the state and distributed through various networks. We also saw a new program, USDA Farmers to Families program. So you might have heard about how some farmers were having to dispose of the products of their harvest simply because the usual ways in which food was distributed throughout our food systems, a lot of their food was going to restaurants. Restaurants were closed, and therefore there was nowhere for that food to go. A new network had to be built so that that food could be used. The USDA was delivering 4.5 million pounds of fresh food per month to Colorado. That program was scheduled to end in October 2020. And so what have we learned from this period? I would like to see us examine what went on during this period. Some in-depth studies are going to be necessary. There were some that were performed after the Great Recession and found that there was a temporary increase in SNAP benefits during that time period. And they found that those benefits lasted longer. So people use an electronic card called an EBT card to access their SNAP funds. So the usage of those cards can be monitored. And what they found was that cards were being used closer to the end of the month. SNAP benefits come in at the beginning of the month. They're used until they run out. They found that people were going further into the month and using those benefits, therefore obviously needing those benefits. Before that, food would, their food dollars did not stretch to the end of the month, which means that they were having to try to come up with the money for more food. I think we found in studies that people spend at least a third more than the amount they get in SNAP on food. So we expect to see similar results from this period. One thing we do know about increasing nutrition assistance is that it has some really wonderful benefits for people and for communities. It, besides stimulating the economy because people are spending those dollars on necessary items, it also makes people healthier. Kids pay attention better in school. People who have chronic conditions are able to manage their conditions better. There's less usage of Medicaid and other community health services because people are better fed. There's a lot of benefits from getting that nutrition out to people. And so we are concerned and interested in seeing, now that we have relaxed some program requirements, it would be good to see if we can improve the way people access the program, or even maybe eliminate some of those what were requirements. So we'd like to see increased use of texting to communicate with people. Our departments were able to use telephonic signatures for applications instead of requiring people to come in and sign in person. Increased usage of telephonic interviews. SNAP and WIC do have interview requirements, but these can be completed on the phone. I know that some counties have made an effort towards trying to make it a one-stop shop. So the moment somebody calls and says, I need food assistance, they try to get all of the paperwork squared away and the interview requirement met all in one call using the telephonic interviews and the telephonic signatures. That creates less work for our government agencies and also gives easier access to the programs. That's great. We'd like to see more of that. For a while they were waiving interviews altogether, simply so that they could push the benefits out to people faster. We might want to think about, in the future, how necessary is it to have these interviews? Now, actually eliminating interviews would be a matter of federal advocacy and not state advocacy. But to the extent that we need to communicate with people about the program, can we make these shorter, or can we find other ways of getting them the information and also getting the agencies the information that they need from clients in order to qualify them for benefits? Claims collection has been halted for now, or at least actually, I think it just started up again recently, but sometimes people are paid too much on benefits, and so they end up owing the agency money for a time period. We were just saying to people, don't worry about that. We'll come back for that later. And there's also been more consideration of compromises and waivers of the amounts that people owe. So looking more at, can you actually pay this back? Can we make it at a lower amount? Can we just decide that we don't need certain things to be paid back if they're small, or if the person who had not communicated with the agency, it wasn't their fault that that happened. So we're exploring that as an idea for more of these claims. The school lunch program has a number of program requirements that have been waived for the time being and are going to continue to be for the foreseeable future. So things like requiring students to be on site to get the lunch. A lot of districts have now gone to a grab and go method, which seems to be working. Requiring students to be provided with an activity at the same time as they get the lunch. Okay, maybe we don't need to do that. Saying that if only a certain number of kids in the district get school lunch, therefore only those districts can provide the additional school lunch benefits such as grab and go. Well, we've waived that too. So more nutrition and food getting out to more students, more families. And we've also seen that food banks and pantries have worked valiantly to expand their capacity, especially their capacity to handle fresh foods. One thing that's been a long-standing issue with food banks and pantries, one thing that they've always wanted to do more of is provide more fresh food, but that requires more refrigerated storage, and not always was that available to them. At the beginning of the pandemic period, there were many creative methods being used by our partners out there in the food space, utilizing restaurant refrigeration, school districts, and their refrigerated facilities until more of their own could be put into place. And just would like to say for a moment, how much I enjoy all the effort that people have put in to make food insecurity less of a problem for Coloradans. I'm on calls regularly with a lot of people who are working in the food space, and it's just been an incredible effort, and everybody's really risen to that challenge. So for the future, can we make these programs more generous to folks, more attractive, so that more people actually want to sign up? We've always had some undersubscription in SNAP and WIC. About 65% of people who were eligible for SNAP were enrolled. About 50% of people who were eligible for WIC were enrolled. These are probably higher numbers now, so people who perhaps were eligible before but maybe didn't feel it was worth their time to complete the paperwork and the requirements to sign up for SNAP and WIC perhaps now have had an experience of those programs. And one reason that we've heard consistently about WIC is that it needs more fruits and vegetables. Its nutritional requirements need to be brought more in line with what we know now about healthy nutrition. One thing that I hear a lot is from people who work directly with WIC clients is that they say there's too much juice, there's not enough milk, there's not enough fresh veggies. We want people to have all those things. So at some point, perhaps we can advocate at the federal level for an overhaul of WIC nutrition. An increase in the SNAP minimum benefit is also something that CCLP would like to work towards. The least amount you can get on SNAP is $16 per month. If you qualify for SNAP at all, then you get no less than $16. Right now, everybody is getting what's called the maximum benefit. So for a family size, there's a certain amount that's considered the maximum. And then from that, deductions can be taken based on a person's income and expenses. And that's how they arrive at the amount that someone qualifies for their monthly SNAP benefit. But right now, what we're saying is if you get any SNAP at all, you get the total amount. No deductions are being taken. So that makes it much more worthwhile for folks. We've talked about when that is over and we go back to the normal way of doing things, can we increase that minimum benefit? What would be the amount we could increase it to that would make people feel more like they want to get more of that nutrition and that it would be worthwhile to them to work with our state agencies and counties to get that. And we're also thinking about different ways of dealing with claims collections, compromises and waivers going forward. So all that we're considering and all that we're thinking about doing is we would like to get more people enrolled in programs, and we would also like more people to not just get enrolled, but stay enrolled and benefit from that nutrition. So I'm ready for questions if we have them.
Thanks, Sarah. Yeah, I've been compiling a few questions throughout the presentation. Uh, First one's from Laura Weir, and she would like to know, do people on SSI and SSDI qualify for SNAP? If so, how long are they eligible? And you may need to provide a little bit of context on SSI and SSDI for those out there who might be unfamiliar with those.
Okay, sure thing. So SSI and SSDI are two different kinds of federal disability benefit programs. SSI, Supplemental Security Income, is a means-tested program, which just means you have to be experiencing poverty in order to qualify, and that you also have to show that you don't have enough of a work history to qualify for a higher benefit level that's based on the amount that you've paid into the system. SSDI is the disability retirement program for people who can show disability but also have that strong work history so that they get paid more. And the issue with there's nothing that says that people who are on SSI and SSDI cannot qualify for SNAP. The issue often with those folks is that their income is put into a category called unearned income as opposed to earned income, so that fewer deductions can be taken from it. So like I was saying before, a lot of the people that you see getting that minimum SNAP benefit, that $16 per month, are folks who are on those programs or who are retired and their only income comes from Social Security retirement. So the people who get the minimum benefit are disproportionately either experiencing disability or are seniors. So we would like to increase that minimum benefit, and it would, if we did, we primarily would benefit those folks.
We have another question from Laura. Do you observe food banks around Colorado, or at least in the Front Range, to be coordinated? And she sort of opines here that providers seem to have limited knowledge of where different ones are located, hours of service, etc.
There's some large food banks and then there's smaller pantries, and they do coordinate with each other, but they are somewhat broken up by region. So there's the Larimer County Food Bank, there's Weld County, there's Rocky Mountain, there's Care and Share, and they are in different areas of the state, and then they will often be supplying pantries that are even more decentralized than that. So there might be, some small community organizations or churches that are also getting food from them and pushing that out.
Okay, we have another question here from our colleague Sara Robert. It seems like many who could be SNAP eligible don't want to try to get help from the government, or some newly unemployed may find just getting food, no questions asked, at a food bank seems less daunting than applying for SNAP. But it overwhelms food banks if people aren't also tapping SNAP. Does SNAP do outreach at food banks to encourage them to apply?
Food banks often have a SNAP coordinator to help people apply. But yeah, I hear what you're saying. It is daunting for folks to get on the program, and it does seem easier to, in some ways it is easier to go to food banks and pantries who don't require near as much documentation. Also, programs like SNAP is limited to people who have a documented immigration status. Therefore, people who do not have that status would have to access outlets that don't require such documentation, and that's much more often to be food banks and pantries.
We have one more question. About all the flexibilities you've described that have been available during the pandemic, such as electronic signatures, can the state choose to extend those after the emergency, or will that only happen if there are federal changes?
Some of the things like telephonic interviews were always an option, and I think some counties, especially the larger counties, were already using them. I think the state's been encouraging all the counties to use them. Some of the smaller counties perhaps feel that it's not as necessary for them because they don't have as high a volume of applicants. But in those counties also, I think there are transportation issues, so that is important even for those areas as well. Telephonic signatures seem to be, I'm hoping they are here to stay. And I mean, they had to put some technology in place to allow that to occur, because if you're going to do what they call it's not an electronic signature like signing a document online. It is more a verbal assent that is then recorded and kept in a data bank so that it can be shown that this person really did, agree to submit the application. So yeah, I think these are things that can continue, especially if we are able to upgrade our technology and keep it, and expand it. So, that takes money. I think if you've heard in some prior presentations that we've had here that this is perhaps not the best year for that, but these ideas are going to continue to have support from us and other advocates, and I think also from our state partners.
Great. Thank you so much, Sarah. I think that wraps up the Q&A portion. If anyone out there, any of the participants have questions for Sarah offline, we've listed her email here. And moving along, that actually concludes day one of our Communities Against Poverty event. Tomorrow we will we'll kick off with the third in our webinar series. It's on tenants' rights during the protecting tenants' rights during the pandemic. That's hosted by our senior attorney, Jack Regenbogen. Then at noon, we'll present our keynote speech from Pulitzer Prize winner Tony Messenger. He's a columnist for the St. Louis Post-Dispatch who frequently writes on criminal justice and racial equity issues. And at 4 o'clock, we'll have a CCLP happy hour, kind of giving more of a social aspect to this virtual event. That's usually a staple of real live events. And we'll continue on day 3. Highlight there would be the State of Working Colorado preview, or a preview of the State of 2020 State of Working Colorado report. So a little bit more housekeeping here. Once again, I want to give a shout out to the sponsors of this webinar: Colorado Coalition for the Homeless, Colorado Children's Campaign, and Tiffany Lennon, as well as all of the sponsors for the Communities Against Poverty event, both presenting sponsors and supporting sponsors. That concludes today's activities and sessions, and we'll hopefully see you all tomorrow. Have a pleasant evening, and Good day.